Well, for over a century, the Cigarroa family has had the privilege of caring for so many wonderful patients from Laredo. It's a city that is populated largely by Hispanics, many from Mexico. When it suddenly became the epicenter of this horrific pandemic, as a frontline physician, caring for so many patients with COVID, what was going on in your mind and what were the decisions that you made?
In March, we had our first COVID-19 patient. So he infected our nurses, our doctors, the custodial staff, the cafeteria people, and the first surge of COVID in Laredo Medical Center, our hospital, was the epicenter of it. And at that time, this was now the third week of March, I decided that I was going to close my cardiology practice to cardiology and begin taking care of COVID. I remember distinctly thinking of Dad at the time. And I said, Dad would go to where the illness is. And there was a tremendous amount of fear because there was no treatment, because it was so infectious. So when someone in Laredo was diagnosed with COVID, the hospitals did not want them. They were sent home, and they were treated like lepers. And so I started making house calls. When you make a house call, you don't take care of only the disease. You see the entire panorama of what that family is going through.
And then you end up getting COVID.
I did not get COVID from a patient. And I think that that was very important because remember the fear. And I didn't want others to fear taking care of COVID patients. I got COVID-19 when I gave a news interview at our local TV station. And 14 of the 18 employees that day had asymptomatic COVID. And the reporter had symptomatic COVID. During the interview, I said, oh my God, this guy has COVID, but I didn't have my mask on. My daughter, who ran a social website, Laredo Contra COVID, kept her mask on. She didn't get it, I did.
What did you learn from that experience?
It was clear the virus doesn't discriminate. The virus does not discriminate. It's going to hit the young, middle-aged, and the old, whoever's exposed to it. And then, if the virus doesn't discriminate, why does government discriminate? Why in the world did we allow the federal government to give these vaccines to the state? There is institutional discrimination. And I can only talk about my community. We were the #1 hotspot in the country, not in Texas, in the country for weeks, in the state for months. We get half the vaccines that a similar county with the same population, Lubbock County, gets. And their incidence, minuscule compared to ours. How do you explain that? There's only two ways. One, it's discrimination, or two, it's stupidity. But I have lived on the border all my life. My family has lived on the border for 100 years. The border has been the bastard child of Texas. We were unprepared. But a true leader is going to send the National Guard, the military, whoever they need to send to a community that's in dire need to save us.
Exactly.
And so that institutional discrimination has occurred and still occurs is clear in my mind. Because they're not stupid.
How do you think the individuals now look at providers? What's the view of the public to medicine
I think it changed
now?
dramatically. I think that the public has gotten a glimpse of what healthcare providers go through. The heroes, the nurses, the custodians, the cafeteria workers who continue to go to work even though the enemy's there. They show up every day and they do what they're supposed to do. It's about taking care of people and being compassionate. We all took an oath, and we took that oath seriously. And we're going to go where the illness is, even if it means that it might overtake us.
And now I know why he's called the Fauci of South Texas. It's an absolute honor and a point of great pride for me that the Physicians for Human Rights, is recognizing you as the 2021 Human Rights Awardee. I'm so proud of you, brother.
Thank you very much.
I love you.
I love you more.